All right, once again, greetings to you all. This time around, we are going to have a presentation just on hypertension. As usual, Dr. Ed, remember to like my presentations, then you can also subscribe to have a variety of medical presentations. All right, so we're going to just see what hypertension means. Then we see what are the causes of this hypertension, and also we shall talk about present complications caused by hypertension in case it is not treated. All right, without wasting time, let's go straight to definitions. So when we talk of hypertension, people just say high blood pressure, but to maybe students, if you're defining it, it is easy to, and it's most awarding if you say the persistent high blood pressure of systolic that is above 140 millimeters of mercury, and diastolic which is greater than 90 millimeters of mercury. Some other books may say that somebody having a blood pressure which is systolic 130 out of 85 and above to 140 out of 90, that one is pre-diabetic. But many books and in clinical practice they consider the first this very 140 out of 90 as the upper cutoff for normal blood pressure. Okay, so if we say blood pressure, what are we meaning? There we are meaning the pressure exerted by blood when the heart pumps that pressure which is exerted on arterial blood walls. So pressure exerted by blood on arterial walls. And when we say systolic blood pressure, that's the maximum pressure exerted in the arteries during the contraction of the heart. The opposite is diastolic blood pressure, which is the minimum blood pressure exerted in the arteries during relaxation of the heart. So as I've said, normally blood pressure is considered to be 90 out of 60 to 140 out of 90 millimeters of mercury. That equation which we are seeing, that BP equals CO multiplied by PR, it's just some relationship explaining the determinants of blood pressure. So CO is just cardiac output, which is the amount of blood which is ejected from the heart per minute, whereas PR is peripheral resistance, which is that resistance created by arteries, which is determined by the arterial lumen, the diameter of the arteries. Okay, so therefore either increasing the cardiac output or increasing the peripheral resistance can lead to increase in blood pressure, which is hypertension. Okay, so we're going to just first see the classifications of hypertension with their causes. So we have primary hypertension. It is also called essential hypertension, defined by the virtue that the cause is unknown. So there is always peripheral resistance, but the cause is usually unknown. It has also classes as benign hypertension, which is always symptomless, and somebody can go to a hospital without any symptom, but on just a checkup they find when the blood pressure is high. The other one is malignant hypertension, which is a severe form. The blood pressure can go up to 250 out of 150 millimeters of mercury, with even some complications, the eyes, the headache, sight blurring, all of those complications with this form. Okay, so what are the risk factors to developing primary hypertension? Okay, so since the cause is unknown, then we have these factors like age, whereby somebody on growing up, you find there are changes in the body, including blood vessels, and so may become less elastic, so putting somebody at a risk of developing high blood pressure. We have smoking. Okay, in cigarettes, we have some chemicals called nicotine. We have tar, which have direct effects on blood pressure by affecting arterial walls, making them inelastic, so in that way causing indirectly increased blood pressure. So we have obesity and sedentary lifestyle. An obese person has a lot of fats, so these ones they at times get deposited into blood vessel walls, so interfering with the normal relaxation and contraction. We have hormonal contraceptions. They just contraceptives. Some of them they cause reduced blood movement by making blood more viscous, and so relating to high blood pressure in such a way. Positive family history. They say that if your parents have high blood pressure, also the siblings are likely to have. So alcohol consumption, still to these chronic consumers of alcohol, there may be some changes in blood vessel because of this alcohol, so interfering with the normal relaxation and the contraction of the arterioles. So stress, that is related to increased production of catecholamines, the adrenaline, related to stress, which have vasoconstrictive effects on blood vessels. When we talk of too much salt intake, there we are driving to something related to water retention increase, and so increasing on cardiac output and consequently hypertension. Right, so let's see for secondary hypertension where the cause is known. So the causes may be cardiovascular. There we have arteriosclerosis, atherosclerosis. Those are narrowing of the arterial lumen, affecting also the arterial walls where they become brittle and so don't contract and relax normally. Coarctation of the aorta, just that's narrowing of the aorta, so leads to increased blood pressure. Endocrine, we have things like pheochromocytoma. That's an adrenomedullary tumor which produces too much catecholamines, which put somebody to developing hypertension. Whereas Cushing syndrome, which is manifested by increased production of cortisol. Still, cortisol has a way to do with increased high blood pressure. Hyperaldosteronism, increasing aldosterone hormone, or still increasing salt retention with water retention. We can consequently have increased blood pressure. Diabetes mellitus, it has glucose too much is saturating freely in blood, so there's effects on blood vessels, still can lead to the other atherosclerosis. Alright, so others of the renal, that's kidneys, you have stenosis of renal arteries. When there is stenosis, then we have limited blood flow to the kidneys, and because of that, the renin enzyme may be secreted, which through the RAS system leads to increasing blood pressure. A tumor in the juxtaglomerular cells, definitely that one leads to increased secretion of enzyme renin, which converts angiotensinogen to angiotensin 1. Then with ACE, we can have angiotensin 2, which is a potent blood vessel constrictor. In the nervous system, you can have increased intracranial pressure, lesions in the tractus solitaris, which is a control center, so it will be interfered with its controlling vascular abilities. So pituitary gland tumors, if there is a tumor, can lead to secretion of many hormones, including that one leading to secretion of cortisol. Still, we can have increased blood pressure in the same way as I said above. So pregnancy, that one is a risk factor whereby some mothers do get pregnancy-induced hypertension, also called gestational hypertension. We shall see it more in the complications. So complications, if it's hypertension, if it's not treated well, then we can have the following complications. So neurologically, we can have stroke, also called cardiovascular accident. This one also has its own complications like paralysis, things like loss of neurological functions generally. So we can have hypertensive retinopathy. That's when also some retinal blood vessels rupture. Okay, so still we can have cardiovascular complications like hypertensive cardiomegaly. This one, it's when the heart is trying to overcome resistance, we do get hypertrophy of the heart muscles, the myocardium, and because of this hypertrophy, we shall get this hypertensive cardiomegaly. Still, since this hypertrophy will be there but still not overcoming the resistance, we can have myocardial infarction, which is the death of the heart muscles following ischemia. Then heart failure consequently will develop aneurysms, that's abnormal bulging of arteries. So during hypertension, aneurysms can develop. So for the renal complications, we have liver, we have kidney failure. Okay, so this one can follow ineffective blood supply to the kidneys. Then if the kidneys fail, then we do get cases of uremia, which is accumulation of too much urea products in blood. Somebody can manifest with loss of consciousness, among others. So for pregnancy complications, we can have eclampsia, which is defined as increased blood pressure during pregnancy, mostly above 20 weeks of gestation, and it's manifested by fits. So the mother convulses, there is increased high blood pressure. So also we have intrauterine fetal growth restriction, whereby you find there is stunting of the fetus in the utero. So this can lead to stillbirth and other very many complications. So however, these are the references. You can get more from the Medical of Physiology by Guyton and Hall, 11th edition. Also Essentials of Medical Physiology by Primus Brigham. Those are nice books. Wow, if you want to pass, they can really help. Okay, so we've come to the end of this presentation. You can like and subscribe for more presentations. Just this is to help many people just in day-to-day living, understanding your life, and those at school also getting knowledge, because these presentations are simplified. All right, so thank you for listening. Yeah, thank you. Just subscribe and like my presentations. Thank you.